I have the chart of one of our patients, Igor, who is lucky to have been chosen for our experiment on 50-year-old man.
To make the second half of his life more enjoyable, Igor Konikov is a difficult case. I mean, if he was 30, 40 years old, there's something we could do, but 50...
It's almost nothing.
Impossible.
We'll try.
I don't think I could do any of this just with the resources we have. I think we're going to have to call in some consultants. Who do we have on the list?
We have a group of very, very, very good professionals. Okay, let me see. First one, Dr. Veronika Anisimova. Just a second, I'll call. Hello, Dr. Veronika Anisimova. Please welcome.
Oh, it's fast!
Hello.
Hello, Dr. Anisimova?
Yes.
Hi, I'm Dr. Gray.
Okay.
What is your specialty?
I am gynecologist.
Excellent! Do you have another specialty?
Of course, you know, my hobby is trampoline. And does this patient have trampoline experience?
Trampoline?
Trampoline, yes.
Yeah, actually, that's very good. Little known fact, it says here that his childhood dream was to fly an airplane, and that on his birthday, what he wanted was to fly an airplane for the first time. His trampoline's kind of close, right?
Sure.
Gynecology, for sure.
You know, I think it would be wonderful. You know, trampoline is great for him, especially at his age, because he needs to have healthy heart in case of catapulting. Right?
Catapulting,
and, yeah, catapulting. And but you know, my concern is I don't know how heart condition, right? So maybe you know we need to invite cardiologist.
Cardiologist.
Oh, no problem, docs. We have
a
the best.
cardiologist?
Yeah, I can call right now.
Okay.
Yeah.
You call.
Thank you, doctor. You're
Thank
welcome.
you.
Okay. Hello. May I speak to cardiologist Lydia Pardal? Yeah. Yeah. Thank you. Welcome. Welcome, Lydia.
Dr. Bardal, thank you for coming. We're wondering if you could assess our patient here. He wants to go flying. This is his chart.
But I think first you have to go to psychiatrist.
That's reasonable. Thank you.
Thank you, doctor. Thank you, doctor. We have psychiatrist notes here. Igor,
Can I see his? We have a previous psych assessment here.
Yeah.
This is Igor. It's in Russian. Истинный канадец. Характер нордический, выдержанный. С товарищами по работе поддерживает хорошие отношения, безукоризненно выполняет служебный долг, отличный спортсмен, особые успехи в лыжном спорте, отличный семьянин, в связях, порочащих его, замечен не был. Okay. Do we have a more up-to-date assessment on?
Yeah, I can call you.
Psychologist?
Yeah, we have psychologist. His name is Pavel Raku. Just a
Excellent, I
second.
know that guy.
Yeah. Hello. Hello.
Hello?
Pavel Raku, please.
Yeah, come in.
Hello, you're the shrink.
Yes, yes I am. All right.
Thank you for coming in. Listen, we got a bit of a funny case here.
Okay.
50 years old, he wants to go flying. He's kind of been cleared by gynecology. Just give him a kind of a once over.
Okay, you mind if I
Yeah, no.
Okay. Okay. Well, after analyzing the psychological assessment that you have completed, I concluded I see no signs of substance abuse or dependence. I don't see any personality disorders that would make you inclined to want to hurt yourself or anyone else. So I clear you as mentally fit for flight. But I do recommend you consult with a lawyer first.
Lawyer.
So, yeah, here you go.
I don't think I know any lawyers.
You know, let me see. We need one. We have one. Her name is. Yeah, I'm calling. Just a second.
Okay.
Hello.
Hello.
Oh, David Young. Yeah, could you please?
Sure. Mommy. Hello, Mr. Conica. My name's David. I understand that you have retained me as your legal representative on this case. Well, before we start, you can have a seat, please. Before you start, I have a couple things I need to ask you, okay? So, this is just very routine questions. Okay, Mr. Conica, I understand you're 50 years old. You're going to be? Yes. Okay. You don't smoke, you don't drink, you don't have any pre-existing health conditions that I'd be concerned about? You don't use oxygen at home or any heart conditions? No, nothing? Okay, good. I see that you, and we agree that you live with a family of 4 or 5?
I guess
a dog, a couple cats. Oh,
somewhere.
Cats. No. Okay. So based on this policy, I see that you cover for quite a lot of things. For example, in the case of emergency, you entitled to the lesser of the rental purchase of a hospital-type bed, a wheelchair, brace, crutches, any medical appliances. You will have your remains sent back to Canada, but we only cover up to $5,000. So and we'll send back your children, your luggage, your cats and dogs if you bring them with you. Yeah, everything else you don't have to worry about. You can just sign here, and I think we're ready to go. Okay, sir, I see that you're a little bit concerned about it. I understand it's a big risk to take. Lucky for you, we have a very good doctor from China with traditional Chinese medicine. I suggest that you call it first. Actually, I'll call it for you. Just one second. Can you stop? 喂，新华医生啊。是。我是 David 啊。您现在有空吗？来一下。好。OK。马上就去。OK。我们有一个病人，就是他最近去开飞机，然后呢，他有点害怕，就听说您有一个绝招可以帮他。
这个是从中国来的，他的名字呢，在中国叫白酒，在这里叫 vodka， 就下 vodka 啊。这个东西呢，你不要顾虑，吃了以后有人说会头晕，有人说是胃不舒服，但是没关系。如果你吃了以后，你会觉得很舒服，很温暖，所以呢不要怕，因为吃了以后对身体有好处。所以今天是Igor的生日，50岁的生日，我送给他作为礼物，我祝他身体健康，永远幸福快乐。Happy birthday！
这块是这是什么？
这是vodka， 中国的 vodka。
中国 vodka. It's Chinese vodka.
白酒，中国叫白酒 ，white wine。
This is excellent. I think it'll be very good for your courage, but I'm worried at this age whether you'll be able to swallow it without choking on it. I really think before you start drinking the Chinese vodka, we need to have a formal swallow assessment.
We
Do we have a
have
speech
one.
language?
We have speech pathologist. Just a second. Yeah. Hello. Елена Земцова, please. Speech pathologist.
Hi.
Hi.
Nice to meet you. Hi.
Funny patient, you know, he has some vodka for bravery. We're just wondering if you can keep it down. You know, I just don't want him aspirating, and he's an old man.
What's his name? Sorry.
Igor.
Ikonikov.
Yeah. You've seen him? You've had him before?
Born in 1964.
Yeah.
And he was living in Sevastopol. Рыбочка моя. Игорюшечка. Я вам всем должна сказать, я этого пациента знаю дольше, чем кто бы то ни было здесь. Дольше, чем его жена, дольше, чем его сын и даже его теща.
She says she's known him for longer than any of us here.
Первый раз я увидела его в 3 классе, когда его посадили ко мне за парту. В городе Герой Севастополя.
They sat together in 3rd grade.
Да. Несмотря на то, что у нас очень большая разница в возрасте, мы одноклассники. Что я могу сказать? Когда я смотрю на этого мужчину, я вспоминаю, как и Соловьева, «Похождение Хаджина Средина», когда он смотрел на свою жену, краснолицую, полную, крикливую женщину, родившую ему 7 детей, по-прежнему увидел кроткую голубку Гюльджан. И когда я смотрю на эту крепкую мужскую фигуру в бороде, я по-прежнему вижу кудрявого, худенького, стройненького, брючки клеш, рубашечка в талию, на гитаре поет хорошенький, нежный. Игорь Николаевич всю жизнь был способен проглотить любые трудности. Поэтому я больше чем уверена, что он проглотит все, что угодно, все, что ему судьба приготовит. Но вот я бы хотела убедиться, что он способен все это проживать. Позовите дантиста.
Yeah, we have.
Okay, do you have a dentist?
Yeah, we have a dentist. Just a
Okay, so
second.
doctor, don't
I
worry, he's gonna be
call
fine.
the dentist. Thank you very much. Dr. Kenny?
Yeah.
Hello? Dr. Crisol, please.
Thank you so much for coming on such short notice.
Thank you. Let me see the chart. Seems like something's missing here. I remember that I referred him to 2 specialists here. Okay, I would like to see that one. Let me ask the patient.
It's supposed to be fictional.
Okay, I'll give him a clearance to fly, but do you promise to go and see the specialist?
Yes.
Okay, that's impossible. Okay, all my witness.
We'll get the lawyer to write it down.
And one more question before I give him clearance. Do you floss every day? Do you floss every day?
Yes.
He's cleared. Enjoy and have a safe trip.
Okay.
Okay, the assessment is almost over. For the last touch, we must make his life wonderful, pleasant, and comfortable when he will be back from his flights, you know? And we should call all available social services. We have a lot. We have a huge list of wonderful sources.
Do you have that can guy? He's really good.
Yeah, Ken?
Yeah.
Oh,
Ken
no
is
problem.
Chinese.
He's the first here.
Okay.
And, okay. Hello, Mr. Ken.
Hello.
And your lovely assistant, could you please come?
Of course, yes. Let me come right now. Hope you don't mind. I brought my dietitian, in-home dietitian.
Well, thank you for coming on Sunday. It's so nice of you guys. Thank you very much. Yeah, this is the chart. You can eat, speak, swallow, chew. We just want to make sure he has some social supports in place when he gets back for all the stress.
Well, it seems like very supportive family, very supportive dog, even more supportive cats. Seems like he might be pretty clear to go on his flight and come back and have some good social supports coming home. But I thought that I'd have my dietitian come and do an assessment as well.
All right, so nice to meet you. I'm Charmaine. I will be your dietitian. Can you do a quick turnaround for me? Good. Okay. Now let me grab my measuring tape. I hope you don't mind.
Do you want me to get there?
Oh, thank you. Okay, so we do some quick math to calculate your BMI. Okay, so according to my assessment and your diet history, which we do have a record of there, I do recommend that you increase your caloric intake, so eat a bit more to make up for that airplane food you'll be eating because you're fit for flight.
Thank you, guys.
Thank you.
Dear doctor, from the chart, we can see that the patient's life is very stressful at work and at home, you know.
Agreed.
Yeah. Maybe he should think about another profession. At this age, maybe he can choose like something more pleasant, more enjoyable for him. And I know one person who can grant any wish in this area. Can I call him?
Sure.
Just a second. May I ask to come case manager of Etobicoke and Burlington hospitals, Lily Perwas, please.
Hello. How are you? Very nice to meet you, sir. How are you doing? Happy birthday, by the way. Okay, it seems like we have a nurse and we have a doctor here. Very nice to
Thank you
meet you,
for
sir.
coming.
How are you? Seems like you like to go and fly. Okay? And as you know me very well, we did the nursing degree together, undercover, okay, you know, with another name. And I think when you come back, you should be a nurse. Even if that's now, you should become a nurse, seriously. We drink, we have parties, okay, and you can do whatever you like within the nursing profession. Also, it has so many, my doctor here can help you right away, right? He can work with you. Oh, he can work with you. What do you think?
Thank you, Lily. Yeah, I think it's perfect. I can share with you my experience. It's very nice job, good people, no stress at all. Nursing. Yeah.
You know nursing better than me. Yeah. Especially to do the essays in nursing. You are the one.
All right. The job is great, but how we can help him to deal with stress at home?
I don't know.
I heard about another option, to take stress off with therapeutic animal touch. Animal touch.
Animal touch. Okay.
Yeah, and we have a wonderful opportunity to invite the president of Mississauga Humane Society and ask her to provide the appropriate number of cats and dogs this coming year.
Do you think she'll come?
Let me try.
Okay, we'll come.
Hello, may I ask to come Lily Chan, the president of Mississauga Humane Society.
Lily, thank you for coming.
Thank you.
This man, he needs some animals.
I think
Do
he
you
needs
have
more.
any?
I got lots of you. What kind of animals do you enjoy? Dogs, cats,
Furry.
snakes, rabbits. Well, first of all, how's Jack doing? I mean, the biting dog?
Not me.
How many times has he bitten so far?
We gave up to count.
Who's counting?
Yeah, so yes, well, I mean, as a Humane Society's president, I've been dealing with animals for 15 years. And I must say that animals are such good things, especially for a man with approaching 50 years old, who's ready to fly. And they will give you very good therapeutic touch. So before you go for the flight, please stay one night, sleep with them, whatever. And you'll feel very calm and more confident because the confidence comes from the animals. They will let you know they are so loving, they are so kind, and they will remove your stress. So I encourage you to even foster more dogs and cats.
Yeah, sure. For now we have
5?
No, we have 7 cats and 1 huge dog.
Just 7.
Just 7. No, because kitten season is coming. During kitten season,
Don't
usually.
worry, I'll give you more.
Okay,
Is that okay? We must get your approval first because you're the boss.
He will fly away.
He'll fly away. Don't escape.
Thank you for coming.
Thank you so much. Wonderful, but someone will need to help take care of this home zoo. Because a lot of mess is gonna be at home. Yeah, and I have very nice, very respectful person on my list. Can I ask her to come?
Sure.
Anka, PSW. can I do? Here, yeah. What can I do?
Hi, thank you for coming. This man's gonna have a lot of animals, and he's gonna eat some.
Okay, can I? Yeah.
Yes, please go ahead.
Oh yeah, thank you. Can I help you? I can.
It's kind of scary.
Scary. I think after this treatment, he needs somebody to fix his face and everything.
Close up the pores a little and even up the sides.
Yeah. Can we?
Do we know an esthetician?
You know a wonderful one. Do you want me to call him?
Sure.
Renat!
Yes.
Renat!
Could you please?
Hello.
Hello, thank you for coming. Do you think there's anything you could do for this man?
Oh. Well, so you're going to take a flight, right?
Hopefully.
So I guess we need to make you lighter. So let's start with waxing. Right? Don't worry, it's not so painful.
Waxing,
Then we can take a little bit from your eyebrows to shape them a little bit more perfect. And we can finish with nice facial. Nice massage, then you're gonna feel ready that you're flying, and you're gonna be so ready for your beautiful vacation.
And the second part of your life. Thank you, Renat. Thank you so much.
Thank you so much. Happy birthday.
And the last not the least. Our client must have healthy and yummy food to maintain this energy level during such a wonderful life. Just a second. Hello, may I speak to Arina Kuznetsova?
Hello.
Welcome. Of course. Who can cook something more healthy and more delicious than me? Nobody, of course. From this wonderful ingredients, I'll certainly do something absolutely delicious that you'll never forget. Oh, somebody's calling. Who is this? Hello? Of course, my chef, Marian Harmat. He could make it, but he always interferes with my business. And in his opinion, you know what he says? Say hello to Igor. He's a wonderful and handsome young man, but if he wants to be a healthy rabbit, you can go ahead and cook something from these ingredients. But a man